Hello, I got a question by one of my viewers, and he is an old graduate, and it's been around 16 years since he graduated from medical school, and he has been working otherwise in a different country. So there are a couple of things to consider before you want to plan out for residency here in the U.S., especially if you are an older graduate. Um, Number one is why do you want to make the change? Is there any reason for that? Are you looking for career progression, or you're not satisfied with where you are? Or some people just say they have a lifelong goal of doing medicine in the U.S. So, okay, so those are a couple of the reasons that you may want to do that. But before you go, there are a couple of things we need to keep in mind. It will be different for the three different types of people. Number one, if you're thinking about appearing in step examinations and you have not initiated your studies yet. Second, you have completed your step one and at least step two, and you have low scores. Third is you're done with your USMLEs and you have good scores. So for each one of these three groups, it's going to be a little different how to move forward. So for those people who have not studied for the USMLEs or have not uh, been through the exams already, a couple of questions for you. Um, this is going to be a big undertaking. It's going to require financial stability. Depending on what you are doing in life right now, you'll need to dedicate adequate time to the USMLE examinations. You'll have to see how much family support there is. Do you have kids? Who's going to take care of the kids? And how much time can you devote to your studies? And um, down the line, you'll be going for interviews. And how is that going to work out? Have you thought about all of this? And are you able to bring this into your scheme of things? So if the answer is that you'll be able to devote enough time, you're financially stable, and you have good family support, I think if you are motivated and you are intelligent and you're able to take along multiple things at the same time, then yeah, sure, go for it. Um, so so that's for those people who have not yet been through their exams. Second, if you have been out of touch with medicine for a while, I've seen people take a slightly different route, even though they've already graduated. I've seen people go into a DO program, and I've noticed people going into the Caribbean medical school system and do it afresh, basically. So yeah, that may be a route for you if you've been away from medicine for a while and you have been doing non-clinical work, but it may be a little expensive, and you'll have to see if you're able to get loans. But that's the route that people have taken that I know of. Next, if you are already done with your steps, or at least one component of your step, and you have low scores, if you have low score in one component, make sure you have an excellent score in the next one, and do not appear in the exam if you're not going to get a good scores on the assessment tests. So if you have low scores, I think it's going to be much more difficult. And that's why in these situations you should never burn your boats behind you, and make sure you have something in the back to fall back on. Um, so low scores, it'll be tougher, but certainly you can do a couple of things to try to beef up your CV. If you have already been in medicine, I think you can produce lots of case reports and case studies. You may have to pay a little bit to have them published, I think, but I think they will surely help in getting a residency. What must do is try to pull all of your contacts and try to see if anybody can get you an interview. But of course, before that, see if you can get any type of clinical experience. And
my role was working with a second-year resident who had been directed with me to go to the emergency room. We were up on the second floor surgery clinic that day, and we had patients that had come in during the night from for various complaints, and the chief surgery resident directed us to go to the emergency room to take care of them and see which ones needed to be admitted. At that point, we had gone down, and the way the hospital emergency room was laid out at that time, there were cubicles with curtains in front, and sections of the emergency room were for surgery patients, internal medicine patients, obstetrics, gynecology, and pediatrics. And there were two operating rooms that were downstairs that were more major surgical procedures could be performed for resuscitation before taking them into the hospital. And we were in front of one of those when we heard the announcement from the triage desk that they needed stretchers, and there was just a lot of banging noise, which was unusual. I mean, you just wouldn't hear that. They were hollering and screaming through the intercom, and so at that point, Dr. Red Duke was the chief resident running the emergency room. He was in charge and immediately started going to that first operating room, which was operating room 2, actually. There he, as we came out of our cubicle, they were rolling in a gentleman who's gray hair and wearing a silver gray suit, alligator boots, and striped tie, and I thought, what are they doing here at the emergency room at Parkland County Hospital? And it was Governor Connolly, so we went into that room to assist Red Duke in the initiation of the resuscitation. At that point, we undressed him to see where his injuries were. He had a gaping wound in his chest. We put I put some gauze across the wound in order to seal it so that he could reconstitute perhaps with a chest tube